So what was the rationale? This was one of my favorite parts of the document. This was in we have no empirical ability to estimate the monetary benefits for this provision because it's going to cost about $260 million the first year, $180 million in the year 2 and 3, probably more, significantly higher than that, but that's just what they bet it. That's just what they figured amongst themselves. However, there's a non-monetary benefit which are difficult to quantify. Increased transparency regarding the extent and nature of relationships between physicians and teaching hospitals, and manufacturers will permit patients to make better informed decisions when choosing healthcare professionals, making treatment decisions, and deter inappropriate financial relationships, which can sometimes lead to increased healthcare costs. Quick question, I've done this in other things. How many people here have read the transparency reports that are posted on the web right now? That you've looked over the transparency reports. So you're working in a field, that you came to a session on transparency reports, 2 people in the room have looked at corporate transparency reports. How many of you think that patients will ever look at this? So I was in a session full of ACO, Accountable Care Organization directors, on the quality improvement session. So these are the quality improvement people for ACO directors. How many of you have ever looked at Hospital Compare? Not a single hand went up in the room. Somehow collecting this kind of data, has anyone ever looked at an FEC report or or any of this kind of data? It's just not very rarely used. The whole idea that you're going to just run out and use it. But I think they want it basically so that it prevents you from giving them inappropriate. If you're going to give something that's inappropriate and you know it's reported, then you won't do it.